9:47 a.m. And we have all members present today. Can I have a motion to approve the agenda?
I'll make a motion.
It has been moved. Seconded by Barb to approve the agenda.
Oh, Mike's not here.
Oh. All in favor? Aye. Aye. Opposed, same sign. Motion carries. Yes, strike that. Mike's absent. Thought we had a full house. Public, there is no public here today. Agency reports, no agencies. Dee, may we have your report from the Iroquois County Public Health Department?
Good morning.
Good morning.
Okay, so the first thing that I'm going to hand to you is the grants and contracts list that I gave you last month. There are a few updates with that. Let me see here. If you'll take one down and pass it around. We just do whatever.
Yeah.
Are you tired, Kevin?
Yes, I am.
I know. What do you do? Okay. Okay, so to summarize, the only things that have changed since our last meeting, which I think was the 7th of November, if you look at the grants and contracts list on the front page, under Illinois Tobacco Free Communities Program, you'll see that the grant number was issued and it was finalized on 11/8/17. And remember, when it says finalized, it just means that we went through the whole 4-step process where we submit the application, then the application gets approved, then I sign the contract and send it back to the state, and then they sign it and send it back to me. So that means it's all 4 steps are done. Same thing with the local health protection grant, which was also finalized on November 8th. And then on the following side, under safe drinking water, where it shows that the application was submitted August 23rd. It was signed by me yesterday. So in between there, it was approved by the state. Then it takes another 2-3 weeks, for us to get the contract for me to sign back in eGrants. And so it'll take a few more weeks, and then that one will be finalized. Okay? Other than that, I went over this pretty well with you last month, so there aren't any other big changes with the grants and contracts. Do you have any questions about that? No? Okay. It's the same. Okay. The next item I'm going to pass out to you is the summary report program. Oh, sorry, I gave you 2 of them. Not be so lazy and get up and... That's okay. Okay. You'll want one too, dear.
There you go.
Okay, so this has our fiscal year total counts on it. And I did bring the fiscal one from last year in case you want to do any kind of comparison, but I thought I could give you a really fast rundown on it. Just some ones where the numbers significantly changed.
That other one?
Yeah. That's my only copy that I could find because I handed them out so much. When I make a copy of that chart.
I'll give it.
That's okay. So under environmental health, the food sanitation inspections, last year we did 441 and this year we did 544. You can see that we had more permits issued this year. We had 208 versus 199 last year. We also had plan submittals. Last year we only had 2 and this year we had 10. So there have been some new businesses in Iroquois County, so that's a good thing. Our other numbers weren't significantly different. The number of water sample kits this year, we did 189. Last year we did 199. As far as the wells go, the numbers were pretty steady. New wells inspected this year was 30. Last year we had 38. Non-community well surveys, this year we did 35. Last year we did 26. Permits issued for new wells, last year it was 38. This year it was 31. Permits issued for sealed wells, this year was 27. Last year was 36. Sealed well inspections, 33 this year. Last year it was 29.
Once they're inspected, is that for a lifetime? I'm just curious.
Yeah, that's for like a new one, a new drill. Mm-hmm.
But once they're done, there's no re-inspection?
No.
Just curious.
Usually there's a re-inspection done if the home sells and somebody wants it to have it.
Requested.
Right.
Requested, I just
Right.
don't know if it's part of the house.
No.
Okay, no problem.
Under West Nile surveillance and the mosquito samples, there's a big number difference. Last year we did 45 mosquito samples, and this year we did 160. They increased our funding, remember, for that a little bit, so we were able to do more samples.
How do you do mosquito?
I have a
What
question.
is that about?
Yeah. Which one do you want me to take first?
Where do you get these mosquito samples?
Okay, so
How do you collect them?
we have a mosquito trap that we set out in different parts of the county. This year we set it out in
There's one that sits right out here
There's one here.
in the pine trees.
In the pine trees. And then we had one in the Clifton Central area, we had one in the Cissna Park area, one in the Gilman area, and one in the Milford area.
Really?
And we, they're battery operated, and they collect mosquitoes into the trap. The traps are pretty neat. I'll have Terry come and show them to you one of these days, how they work. And then once they collect those mosquito samples, they bring them back to here, and then literally they hand separate the Culex mosquitoes from the other ones.
They're different species.
The different species. And so like an Aedes aegypti is what we were kind of looking for, you know. Or Aedes alopecia, those are the ones that carry West Nile, or those are the ones, excuse me, that carry Zika. So we're kind of looking for those too. And they separate them out, and then they test those mosquitoes.
Where's that done at? Like in...
Right here. We do that here. We test it
Right here?
Yeah. And then we test the mosquitoes for the presence of West Nile virus.
You test them in this building?
Yes.
No kidding.
Yeah. Yeah.
Didn't even know that.
You
Wow. That's
Yeah.
interesting.
We do so many things. Every month, I guess I surprise you, don't I?
Yes.
I know how much we do.
Very good.
Let's see. For radon kits, last year, I just wanted to point out that last year we did 111 radon kits, and this year we did 169. So that's a pretty good increase. So that means people are testing their homes for radon, and remember that radon is the second leading cause of lung cancer. So the natural breakdown of uranium in the ground causes radon gas to leak up through people's homes. So it's very important that people get their homes tested. We have radon test kits at the health department that anyone can stop up and pick up anytime, and they're free of charge. Those are provided through our grounds. Obviously, we had no liquor inspections last year because that was a new one this year. So we did 79 of those. But if you turn the page over to look at community health, here's our big one. Here's our great big number change. Last year, for childhood immunizations, the health department did 629. This year, we did 1,819. Big difference. And we got that done, and it was rough, wasn't it? It was rough because we only increased one of our nurses' time. And And those girls worked their tails off, put in a lot of long hours, and a lot of no breaks and no very short lunches, if any lunches, and yeah, they worked hard. So that was a big one. And then last year, I just wanted to point this out, last year under pneumonia we gave 81, and this year only 43, but we're not done with our pneumonia clinics. This year some of the long-term care facilities decided to do a flu vaccine and then a separate pneumonia clinic. So we still have quite a few. Yeah, we've got some of our bigger places to go yet. So is that just an extra one? Or is that my old one? Thank you. Which anybody wants a copy, I'll be happy to make you a copy. Very happy. So that was our big change under community health. Otherwise, pretty much most of them are pretty much the same. Now I will tell you that one of the other differences was that last year we reported 59 cases of chlamydia in Iroquois County, and this year we only reported 25. And let me tell you what's happening there. I'd love to say we're doing this great job of getting out there and educating people against the prevention of that, which we hope we are. But I also want you to know that because we don't do STD testing directly out of our health department, we send everyone to the surrounding county health departments who have STD state-funded testing clinics where people can go and be tested for very, very low cost, if at all. And some of those surrounding county health departments have free and anonymous testing, so people tend to like that as well. So don't be fooled that our numbers are really dropping that low. I hope that they are, but that what we're seeing is our cases are ending up in the other counties, and she sees it through INEDS, right? Yeah. Explain that to them, how you see that.
When a case is entered in the INEDS, it's entered in the county where they have the testing done. And so a lot of times they'll go ahead and complete that case, and I never actually see it. If it's like Hep C or something like that, it'll get transferred to me. But STDs, they just complete them in the county where they were tested, and then I don't always know what's going on.
Yeah. So we hope we're doing a good job when we're in the schools educating the teens and about, things that, the bad diseases that are out there and the things that can happen to them if they make a poor choice. That those numbers might be dropping for other reasons as well. Otherwise, the numbers, pretty much ran about the same.
Your seniors down though, correct, from last year? Senior services?
Senior services is down a little bit, but remember we are going to be right now we're training someone who's in the process of training for someone who's going to be retiring at the end of April. But that position, that department had 2.5 FTEs and now has 2.0 FTEs. But other than that, the numbers are really not significant, what I would consider a significant difference in the other areas. We did get more flu clinics last year than we did this year because we counted our flu clinics. Last year we had, at the health department, we had flu clinics. And this year we opened it up Monday through Friday so that when our doors are open, people can just come in. So we didn't have like a clinic on a Tuesday from 2 to 4, like we had set up times before. So that number decreased, but it actually means we're offering more services. So sometimes when you look at numbers, you need the details that go along with those numbers to understand what's really going on. Do you have any specific questions? I would be very happy to talk to you about those, if you have any specific questions.
I just took your 2016, put all the totals next to the other ones to see up or down.
Mm-hmm.
Would you say it's reflective upon your employment then?
Yeah.
Good.
Yeah. Yeah. The places where there were increases, we added that nurse who was 3 days a week to 4 days a week, so we added 1 day a week to our nursing staff. And then in senior services, when the numbers went down a little bit, we cut a part-time person. So, yeah, I'm very conscientious about how I spend taxpayer dollars. If you know, look at my budget, I'm not a spender. I'm not a spender. People's tax money is their money, not my money. And I'm very, very conscious about that. I try to be very conscious. So if you have any questions or you get home and start looking at things and have any questions, just give me a holler. Kevin, you're still looking at it. You got any questions?
No, I'm in La La Land.
That's okay. You want me to go on? Are we ready to go
On
on?
these? Yeah, you can move on.
Okay. So, every tax committee meeting, I have been bringing someone from the health department to talk about one of the programs. So today I thought, because animal control is a big topic, and it's on a lot of people's minds, I thought I would talk to you today, Wanda and I would talk to you today about the relationship between Iroquois County Public Health Department and animal control, and why that relationship is so vital to the health of our citizens in Iroquois County, and what we do and how we work together, how it's a joint effort, and why cooperation is so important. Okay? First of all, so I thought I'd start off with a few things here, if you don't mind. And I didn't bring copies for everyone of all of these things, so you are more than welcome to look at these, and I will make you copies of anything you would like to have. But the communication between our departments, two departments, is essential, and it's important for the health of the Iroquois County residents. I can't stress that enough. The Illinois Legislative General Assembly, so if you go to ilga.gov, has all the state statutes, right? So animal control is regulated through the Illinois Department of Agriculture, the Animal Control Act, which is 510 ILCS 5. Okay? The purpose of that, and I highlighted that on page 9, says, and I'll read this to you, it shall be the duty of the administrator or the deputy administrator through sterilization, humane education, rabies inoculation, stray control, impoundment, quarantine, and any other means deemed necessary to control and prevent the spread of rabies and to exercise...
Stop right there. That is that should be taken further. That is the main focus of the animal control.
Absolutely.
And we are blowing this thing out
Absolutely.
of proportion.
Yes. This
Keep
thing-
reading, I like it.
Okay. To control and prevent the spread of rabies and to exercise dog and cat overpopulation control.
Where's
That's second.
Okay,
WCIA now?
it's right here. Would you like to read it in both? And it's right out of the Illinois Animal Control Act.
I
It's
never
a
had a
statute.
problem with any of this.
Okay.
Well, I mean, here's, I think the
But
things,
that's a good point.
yes,
Yes, I
that's
agree.
the focus of that.
WCIA.
Yeah.
The taxpayers' money is for rabies control and second population, and that is it.
That's right.
That's all they pay for.
Okay. Now, that's animal control's Department of Ag statute. Okay. Now I'm going to talk to you about the health department's rules and regs. Okay? So, and I also, before we move on from that, on page 14 of the same thing, it discusses things like the signs and symptoms of rabies in animals, bites, observation within 24 hours by a licensed veterinarian, confinement, the 10-day quarantine period, and examination following that 10-day quarantine period by a licensed veterinarian.
Exactly.
It has to be done by a licensed veterinarian. Okay, now before we get back to this, I want to show you that the communicable disease investigations are regulated, that's the health department's side of this, okay, are regulated through the Illinois Department of Public Health. So IDPH and the local health department authority to do this comes from the JCAR Administrative Code, which is a state statute, Title 77, Public Health Communicable Disease Control, found at ilga.gov, section 691.600 and 690.601. And so I brought a copy of that, in case anybody would like to look at that. It classifies diseases and conditions into different classes. Like a class 1A disease, and it lists all those, are reportable immediately upon diagnosis, okay? A class 1B says the following diseases shall be reported as soon as possible during normal business hours, but within 24 hours to the local health authority, which shall then report to the department, meaning IDPH, as soon as possible, but within 24 hours. And listed under that, it's very clear, any rabies human cases or rabies potential human exposure and animal rabies. Okay? So there's our state statute. So the next thing I'm going to share with you is the Illinois Department of Public Health's reportable disease list. And I'll give everybody one of these.
Thank you.
Okay, this Illinois reportable disease list, you've seen them everywhere you go. Every doctor's office has them up in every hospital, every clinic. You see them reported, every laboratory has them. Okay, so this reportable disease list says at the top of it, mandated reporters such as healthcare providers, hospitals, and laboratories must, and that just says such as, okay? So that takes us next to the IDPH infectious disease reporting guidelines, which are the mandated guidelines if you are a certified health department, okay? And under that, it classifies persons required to report diseases. And there's a list of the people that are required to report diseases, and it says here, it includes veterinarians, and it also includes any other person having knowledge or a known or suspected carrier or carrier of a reportable communicable disease or communicable disease death. So that would include an animal control ward, very clearly, because they have knowledge of a suspected exposure, which is a human bite, okay? So then it goes on to say that they must report suspected or confirmed cases of these diseases to the local health department within the number of days or hours indicated in parentheses. For reporting purposes, immediate means as soon as possible or within 3 hours. If you look down on the second column toward the bottom, it says rabies, human and potential human exposure and animals. 24 hours. So, it is vital that animal
Is that the
control...
only one on here? What's the only one on here that's animal, human? Or there's got to be a few other ones already.
Well, there are diseases that can be spread by animals.
But as far as it relates to animal control, only
This is the one. This is the one. That's it. Well, think of it this way, Troy. You as a county board have voted at some point in time to collect money from people to register your dogs in Iroquois County. In order to register your dog in Iroquois County, you have to show proof of rabies vaccine. You don't have to show proof that your dog had such and such size cage, such and such blankets, toys, sunlight, whatever. You have to prove that your dog has had a rabies shot. Okay? You don't even have to prove that your dog's had distemper shot or that it's been dewormed or anything like that. Rabies. Because animal control is the prevention of rabies. And you know, if you
prevention
really,
and spread.
yes, prevention and spread, right. Okay? So I have a letter here, an email here that I will share that I talked to Dr. Connie Austin because, and I talked to her about this because my fear was, and possibly still is, that we may not have a full-time veterinarian in Iroquois County. And I stressed that to you at the last meeting. And I wanted to know from her, you know, what the implications of that would entail with as far as IDPH goes and as far as our local health department. And she said some thoughts, okay? She said some thoughts. To protect the public health community, animal controls are supposed to be responsible for rabies control in a community. variety of animal species bite people, including both domestic and wild animal species. Bites are the way that rabies is transmitted. In Illinois, bats are the primary species with rabies and are a very high-risk species for rabies. Other species of primary concern are raccoons, skunks, fox, coyotes. And then she goes on to talk about that a little bit, okay? So I want you to remember, I think it's important if you're going to be making as county board members decisions, then you need all the information I can give you to make an informed decision about who is going to handle animal control and whether or not we have a full-time veterinarian. Because it is so much more important than you can imagine. So,
Well, I think it's pretty clear on the rabies, but I think where it becomes unclear is on the, because the second function is population control, correct?
correct.
So I'm assuming that's what gives us the wherewithal to run around and catch dogs. Because you think about it, going around and catching dogs has nothing to do with rabies other than maybe they get checked, but really the bite should initiate that. Or if you saw a rabid acting animal, maybe. But, you know, at some point it starts to look like a shelter, if you know where I'm going with that. So,
I do.
the bottom line is people don't take care of their pets, but that's where we need to define, kind of in this conversation, where's that line?
Mm-hmm. Okay, so the thing I want to tell you a little bit about today is the investigation process of rabies, human and potential human exposure. So, within 24 hours, and just jump in here anytime, Vonda,
I will.
because you do this and I do this. I did this for years. I was the communicable disease coordinator. I worked in communicable disease for all the years I worked at the health department. But I was also the school nurse, so I only did it after school hours and during the summer. So I was the communicable disease coordinator from 2009 through June 30th of 14 when we moved over here, and then I was the administrator. And then Vonda is the communicable disease coordinator as the director of nursing. So we receive a report within 24 hours, and that bite report or potential human exposure report will come from animal control. It may come from a treating provider, like the doctor's office, a hospital, or a clinic, or it may even come from a victim. Okay, we get those calls as
They'll
well.
call wanting a tetanus shot, and that's how we find out that they were bitten.
Yeah. So we assure that animal control has received the same information. That's why good communication is vital. Okay. Then we make a phone call to the bite victim. I'll let Vonda tell you about that.
And I'd review the report that I received and see what information is there and what information isn't, and then I'll call the bite victim, and I want to make sure that I get, what was the species, the description of the animal, if they, aren't sure where the animal's at. That way animal control can at least go out and look for it. Maybe they found out who the owner is since the original bite. Circumstances of the bite are very important, so I want to know what happened and what led up to this. I want to know if they received treatment, did they go to the ER, did they get, the wound cleaned and dressed, antibiotics. I want to find out do they know, is the animal available for confinement or custody. And then I want to talk to them, educate them a little bit about the quarantine process, let them know, we're not just going to put the dog down, animal control is going to be involved, they're going to quarantine, make sure the dog's quarantined, going to get a follow-up exam, and then if I think they're going to need rabies treatment, I'll talk to them a little bit about the post-exposure prophylaxis.
Okay, so there's a lot of steps in this process. But the most important thing that animal control and the health department can do when somebody is bitten is to make sure that we follow all those steps appropriately. They have to notify us within 24 hours. It's animal control's job to quarantine that animal. Okay? Now the Iroquois County Ordinance says that it can be, and the Animal Control Act does allow it. Although the Animal Control Act recommends that all biting animals go to animal control, but they do allow home quarantine, and our county ordinance allows home quarantine. So the dogs can be quarantined in the owner's home. Okay? But
Then are they checked by the veterinarian?
Well,
Veterinarian?
that's the big thing here, okay? So it's the job of the animal control warden to, keep track of that 10-day quarantine period and then go to the, dog owner's residence, if that dog has been home quarantined, and make sure that that dog is still alive at that 10-day period. That homeowner is required by law. By law, it's in the Animal Control, Department of Ag Animal Control Statute. It's in IDPH regulations. By law, that at that 10-day period, that the owner of that dog has to take that dog to a veterinarian and have an examination done. And the examination,
Just a little
it's
card.
just a little card, it's an examination report then, has to be filled out. And every time that a dog bites somebody, that needs to be done. So it's extremely important that the animal control warden get that taken care of, get that examination card, and get it back to the health department as soon as possible, because we are sitting there waiting on whether or not to recommend PEP, which is post-exposure prophylaxis, rabies shots, to a person. Okay, now I want to point something else out to you. I have something else here I would like to share with you. Okay, two things. We follow ACIP recommendations for all vaccinations that we give or recommend through the health department. So even if it's not even a vaccination that we give, we follow ACIP recommendations always. Always. This is our Bible. Okay? We never stray from ACIP recommendations. Do we? Ever. I mean, we have people that call all the time. They're under the age of 60 and they want a shingle shot. Well, we don't give it because, you know, their doctor can give it off, you know, off recommendations, but we follow ACIP recommendations because the CDC says that those are the recommendations to follow. We're certified by the local health, by the Illinois Department of Public Health, which is governed by the CDC, okay? So, ACIP recommendations say that when somebody needs to get PEP, the first dose of the 4-dose course should be administered as soon as possible after exposure. That's day 0. Additional doses should then be administered on days 3, 7, and 14 after the first vaccination. Okay?
What's the cost of this vaccine?
Well,
Let's hear it.
here.
Let's hear it.
Okay, I have it in
I know the
writing
answer.
because I wanted you to. I knew that you would ask me that, and I have it in writing. Hold on a second.
I know what it was.
Where's my letter from Dr. Johnny Austin? Did I give it to you? Okay.
It's up there.
I don't know how you keep track of all.
Oh, here it is. Okay. And I'm going to read exactly what she wrote. And I'll start at the beginning of this paragraph. Another reason rabies control or animal testing is so important is that rabies treatment, if this is needed after a bite where an animal is high risk and can't be tested, is very, she put very in all capital letters, expensive. I get many calls from people saying the first day's treatment at an ED, RIG, which is immunoglobulin, you have to get that before you get your rabies shots, and vaccine was $20,000.
So when we,
$20,000.
I'd just like to add some comments here. You know, this is a little disturbing to me because we've been through all of this before. We had a very competent warden, a very competent veterinarian, and I don't think there was ever a problem in my time on the board with a case. There may have been, was there any rabies shots given? Was it just one time?
Oh no, we recommend rabies shots.
No, the stomach, the bad ones. And we avoided that many times, but the cost at that time was $12,000. So that's probably in line. But my point is, it's almost like we forgot how to do this. So if it is something you can contribute to get this going again in the right direction, I think it'd be greatly appreciated. But this is something that we have done for years, that registration process never went in the red. It always operated properly. People got their tags. I forget the percentage of dogs that were actually tagged. It was really high. That it's like we forgot.
Okay,
Our own
I'm going
rules.
to answer your question directly.
Answer
I'm
it.
going to answer it directly, and I was not going to do that today on public record, but I'm going to answer it because you asked it. We did not have a problem for many years because we had an animal control warden who was on top of this, who went after 10 days and got this taken care of and got these dogs examined. And I was the person, it was Dan Garner. He was wonderful. I was the person he reported this to at the health department from 2009 through 2014, well, till he left. And then we had Shay, and Shay stayed on top of it. And we did not have a problem getting those examination bite reports in a timely manner. If that dog was quarantined on day 10, a lot of counties send their wardens out, and the wardens write fines for them. They write a fine, write them a ticket if they don't. Maybe most counties do write tickets if
There's a consequence.
if you write a ticket if you don't have, if the owner doesn't take that dog after that 10-day quarantine period to get an examination, okay? So by day 11 or 12, I got those reports, and I could then recommend PEP or not recommend PEP based on that examination. And we follow an algorithm, and our algorithm is a little more complicated than that. It determines whether, you have to determine whether it was a provoked bite or an unprovoked bite, okay? You have to determine whether some other things on there. If the dog's available for testing or not. If it's a stray and got away. So those things determine whether or not we recommend the rabies PEP vaccine. And we follow very specific algorithm. And I want you to know that we never recommend PEP lightly because there are side effects and it is so expensive and not all insurances cover it. And we always get the recommendation of Dr. Connie Austin, the state vet. Always. We always get her to back us.
So for the rest of the board, why, I'll throw in some more why that deteriorated, is Doc Fennell retired. I mean, he worked way beyond his retirement years as the veterinarian for animal control, but Dan Garner wanted that spot, but he was not a veterinarian, and that's why he couldn't administer the sedatives or the tranquilizers. Was that that's the whole issue why he couldn't continue?
I don't know what that
So
is.
Doc Fennell had to prescribe the tranquilizers to be used, so I know there's got to be a veterinarian involved.
So it's important that we have a veterinarian. Now, I will tell you this, that if there's ever a time when the health department does not receive reports in a timely manner, all I have to do is make a very simple, quick phone call to Dr. Haney Youssef, and he's on it immediately. I have never, ever had him where I called him and said, we're waiting on this. We've got a little kid who's waiting. Their parents are anxious. They don't know if they have to get their kids the rabies shots or not, and we're waiting on this. He always, there's not ever been a time that I've called Dr. Youssef that he didn't respond right now. Okay? So Dr. Youssef then makes sure it happens.
It must be a
Do you see what I'm saying to
must
you?
be a common thread, because before he left, Dr. Fennell said, if there's one thing I'm going to tell you, it's you cannot mess around with the rabies.
No, look at what happened in Florida just a few weeks ago. A woman died. She was bit by a bat. She did not get her rabies PEP started in time, and she died. And that was sent out by the Illinois Animal Control Association, and it was sent out on Halloween. Big notice.
So why didn't she get it done? What happened?
Well, I can't speak for that case. I don't know all the details, but I can tell you that in Iroquois County, it is essential that we have an animal control warden who will go out and take care of this immediately. It is essential.
Did we have a bat case in this county?
Oh, we have bat cases all the time.
And is it reported?
Okay, since you asked about bat cases, let me tell you this. Last Thursday, we had a bat case. Okay, Thursday, a bat flew in someone's face and it scratched their face up. Okay, now, when we're talking about human exposure, I explained this to you before, we're not talking about just bites, right? So if you come into contact with a bat, bats have bat saliva on them. So a scratch is considered an exposure because it broke the skin, and there's a possibility that that bat saliva got it, was on their bat's body.
Well, your dog chewing one up and then you pet the dog is exposure.
Well, yeah,
Now,
it is.
barehanded exposure.
Okay, barehanded exposure, or sleeping in a room with somebody who cannot,
If you're asleep, you can't tell if that bat bit you. If there's a small child in a room, they can't tell you. If they're intoxicated, mentally handicapped.
yeah. It says if the bat is found in a room with someone unable to state if he or she was bitten or not, and that means small children, people with dementia, mentally challenged people, intoxicated people, people who are sleeping. There are a lot of investigative things that we have to
Unless we
do.
can get that bat and have it tested in a timely manner, we have to recommend treatment.
So has there been timely in our county? Has there been any problems where it's not on a timely matter?
With the bats, yes.
For the most part, we've had pretty good response.
Yes.
Dr. Youssef is involved with the bats.
Yes, because the bats in the state of Illinois are protected by law, they're a protected species. So I've spoken several times with Bob Massey. He's the Iroquois County assigned wildlife biologist from the Illinois Department of Natural Resources.
And the protocol there is they have to take the head off,
Yes,
send the head in.
but the protocol is because they're not only a protected species, but because they have to follow the Animal Control Act, they have to be humanely euthanized. So you cannot just,
Club 'em.
yes. So that means if they have to be humanely euthanized, it has to be done by a licensed veterinarian. So it's not something that the nurses at the health department can do.
They freeze them.
They freeze them and then they're sent to the state lab, and then the state lab sends the results, and the results come to us directly, and they come to animal control
Or an
directly.
animal shelter can't do it, can they?
Unless they have a full-time licensed veterinarian, unless if they have a licensed veterinarian that's working for them, they could. But the problem is this, guys. The timely manner is so important. I want to read something to you from the MMRW. The MMRW is the Morbidity and Mortality Weekly Report. This is directly from the CDC. Okay, and if any nurse in the world can tell you what the MMWR is. But it says here, of the 55,000 persons who die annually of rabies worldwide, the majority either did not receive any PEP, the post-exposure prophylaxis, received some form of PEP, usually without the RIG, the immunoglobulin, after substantial delays, or were administered PEP according to schedules that deviated from those ACIP recommendations that I just read to you a minute ago. And it says that's why those people die. Most die before day 28. That is why it is so very important that this be done correctly and in a timely manner.
See, the difference is you're reading me a protocol there, or reading the group a protocol, and there's a reason for that protocol, the timeliness. Several times, I don't know, who's been on this committee or board with Fennell? You've been? He used to do that verbatim, not on a protocol. He just knew the biological steps of how that was happening.
Absolutely.
What happens at day one after the bite. I mean, he did that.
Absolutely.
I'll bet he did it once a year, Jed. Went through the whole
One of the
thing.
most intelligent men I've ever met.
So, again,
And
What if
Dr.
we-
Youssef does know that as well.
we're forgetting,
He absolutely does.
what we've done in the past successfully.
But your veterinarian is only as good as your animal control warden goes out and completes these steps.
But isn't he responsible for the animal control director?
Yes, and I knew somebody would ask that.
Hang on a minute, let me talk a second. I'm not sticking up for anybody at all. That's not what I'm doing here. So, if he's responsible for the animal control director, then it's his job to make sure that that person is doing their job, correct?
That's correct.
So if it's not being done in a timely manner, it's partly due because of Dr. Youssef. However, I have never questioned his credentials or his work or anything. I think he does a fantastic job. I'm not questioning that at all.
Okay, so let me
I'm just questioning why he didn't, if something's not getting done in a timely manner, like it's supposed to be getting done, then he should step in and say that it should be getting done, correct?
That's absolutely correct. And let me say that to you. This is important, and I hope everybody's listening, because I want you to hear this. I am ultimately responsible for every single thing that happens over at the health department. The buck stops with me. I am responsible for everything. but I am not a school teacher, and I don't check everybody's homework every day because there aren't enough hours in the day to do it. There aren't enough hours in the day for me to go to Wanda. Did you get all your stuff done and show it to me? To go to Terry, or, you know, to go, there aren't. My staff knows exactly what their responsibilities are and what they need to be doing to do them. Now, you can bet that if someone brings it to my attention that they're not doing things in a timely manner, I'm going to be on them. I may even skip through the steps of the Illinois or the Iroquois County policy for disciplining because you know,
It may warn them.
well, without the warning, because it does give you their listings to why you can terminate someone. I might terminate my staff if this is an ongoing problem. If I've talked to them and mentioned to them that this is going on, I may not, honestly, and I'm going to tell you the truth, I may not document every little conversation I ever have with every employee. Okay? But they know what's expected, and if I have to keep getting complaints from other department heads or outside entities, I'm going to be going to that person, and there will be disciplinary action. Up to and including termination.
So maybe we could read in between the lines on this a little, perhaps. Without putting anybody on the spot.
Exactly. That's what I'm getting at.
Yeah.
And, yeah, like I said, I'm not blaming anybody, I just wanna make this right, and we all want to get
Right.
everything to get behind us, including the dealings with the health department and, you know, what happens with I don't mean the dealings, I mean what happens if we don't have that, those kind of things.
Yeah, I'm not saying
That's great information.
that, please don't read into more into this one. The purpose of my presentation to you today is to explain the importance of why we need a full-time vet in Iroquois County, and why it is vital to the health of your neighbors, your family, your friends, your community, and the people you represent.
It's just a shame it has to, it's went this long without somebody reading the primary function of animal control.
Look, I'm all about good care for the animals. Who isn't?
I want a copy.
But the primary purpose of animal control has got to be the safety of the people.
That's right. People first, then
Well, it don't need to be a shelter.
No.
people,
Definitely don't need to be a shelter.
you deal with feelings and older people.
Yeah, but it isn't that. The rabies thing is the first and foremost, but the gray area is the population control, because that's where there's no true definition of why you would go get a dog. If you got one running around, is it because somebody untied it, or is it because it's a male roaming, or is it because it's just a feral dog? I don't know. That's the gray part.
I just wanted to be able to present some information to you today that I will share with anybody, because I think if you're going to be making decisions for this county, you are the county board members, you're going to be making decisions. You need to make some informed decisions.
Right.
And I also think that it's very important that you realize what your responsibilities are. And I'm not trying to tell you, but until you are made aware of all these things, a lot of people don't realize the connection between animal control and the health department, and how it's important, and how we protect people's lives every day. We had 78 cases, was it 78? 78 cases that had to be investigated this year that were human exposure cases. Either a dog, a bat, we had a squirrel, different
Cats.
things. So cats, yes. So it's very important that you realize that there's more to this than what people think that there is. And people's lives and their health depend on it.
It's true.
Agree. Thank you.
Thank you.
I'm gonna ask you later for some copies of some of this.
Absolutely.
I appreciate it, so. And I think that, Troy, that someone or something, some of this needs to be read at the full board meeting.
Good job for Dean.
Yeah. Yeah, you wanna come before the board to do this again? I mean, it's really important for everybody to do
Yeah, I'm
this.
gonna make myself a bigger target now, aren't I?
But now you've got the most passion for that.
Yeah.
Okay,
I didn't hear what
he
you said.
said as long as there is the threat of litigation, we have to be careful what we say and do.
Yeah, true.
I agree.
Once that is not on the picture, yes. we can. I mean, Diaz has heard a lot of things here this morning. As Jed said, you can read between the lines and see where the problem lies.
Right. You don't have
I
to.
don't think it takes a rocket scientist to figure it out. What I presented this morning at tax is a way, actions that the county board took 4 years ago. That's what I have to go by. If the county board doesn't think that should be done that way, then it needs to be changed. But aside from that fact, what Dee is pointing out is essential that we understand what we're looking at here and how we're doing it. Now, that doesn't mean that the veterinarian that we have right now, the administrator, is perfect. I'm sure he's not. None of us are. And if there's things that need to be addressed, we need to address them. There's no two ways about that. And I'm not saying that we shouldn't. But we need to put things in the right perspective. But as far as right now goes, yes, we have a lot of information that we're not presenting right now because of the threat of litigation. And we have to be careful.
All right.
This is a public meeting, and so I don't know how off the record I can say it, but I will, just from being on this board some time, I'd say it's some complacency on our part, but we were spoiled by the system we had in place that just
It operated itself.
5 minutes a month is all we talked about, because it just worked. Would you agree, Bea? I mean, we didn't spend much time on animal control.
He's also pointed out it worked fine up until about a little over a year ago.
It's up to us to make it work. One way or the other.
Plus, we got a good joke at the start of every meeting.
Oh, yeah.
Well, thank you for your hard work going through it.
I just wanna make sure that
People's lives are important.
Yeah, I mean,
More so than a dog or cat or, well, I'm an animal lover, I've got cats and a dog. People come first, for heaven's sake.
Nobody's gonna speak out on that.
Some people would, believe it or not.
Anything else, Dee?
no, thank you for your time.
Thank you.
Thank you. Is there any old business to come before the committee this morning? Hearing none, is there any new business? Hearing none, I would entertain a motion to adjourn.
So moved.
It has been moved, is there a second?
I'll second it.
Seconded by Kevin. All in favor to adjourn, say aye.